Welcome to the Neurocritical Care Society POCUS Bytes. On behalf of the ultrasound section of NCS, welcome to a bite-sized tutorial on cardiac POCUS, where we will focus on examples of the parasternal long axis view pathology to follow up on our previous video on the parasternal long axis view. My name is Diana Alsbrook, a current Neurocritical Care Fellow and ultrasound enthusiast, and I'm excited to learn with you again today. As a reminder from the first video on the parasternal long axis view, this is a video of what appears from a qualitative standpoint to be a normal left ventricular ejection fraction. You can look at a few things to help you determine EF in this view. You can look at the septum and the left ventricular free wall contracting. As you can see here, they both move towards each other and contract, but don't meet all the way in the middle. You also want to look at the anterior mitral leaflet in this assessment, as the opening and closure of this are associated with the left ventricular ejection fraction. In a normal study, this leaflet should not come all the way across and slap the septum, but it should come close to the septum in diastole. So this is what you would describe as a hyperdynamic left ventricle. In comparison to the normal EF video, the septal and left ventricular free wall here are meeting and hitting each other in the middle. This will often be described as a kissing ventricle, as these two walls meet at end systole. Also note the anterior mitral leaflet, which is slapping up against the septum. Coming close to the septum is normal, as I previously discussed. Slapping up against it, as seen here, is not. This finding is not specific to intravascular volume depletion or one specific diagnosis, but would require further investigation into this pathology. The finding of severely low EF, which is typically an EF of less than 15%, tends to be more striking than other findings I've described. As you can see in this video, the free wall has little to no motion. The septum is also barely moving, and the anterior mitral leaflet is not moving in a normal manner towards the septum. This indicates a very low EF. I want to start off by saying that this is a good example of a subpar parasternal long axis view. Now, this was done on purpose, but as I noticed previously, you should not see your apex in this view, as you can see it here, and the apex is more clearly visualized. The RV outflow tract is missing, and some of the other structures are less ideally visualized. This was and is sometimes done to exaggerate the view of a pericardial effusion, which we can see here. Importantly, as we see in this video, you can sometimes see both a pericardial and a pleural effusion in the same patient, so it's important to differentiate the two. A pericardial effusion you're more likely to see anteriorly, notice closer to your probe above the right ventricle. And when you have your descending aorta in view, as we do here, the pericardial effusion would be anterior to that structure, as opposed to the pleural effusion, which is labeled here, which would be posterior or possibly coming up to the descending aorta, but would not be anterior to it. Also of note in this view, some people do have a fat pad over the anterior portion of the heart. To differentiate this, the fat pad moves along with the heart and will also not track posterior to the heart, which this effusion does here. Lastly, for our pathology in this video, we will briefly discuss right ventricular function. As you see here, we break the video into thirds. In a normal view of the right ventricle, it should take up about 1/3 of the parasternal long axis view. In right ventricular dysfunction, you can see the right ventricle, which as you now know is most anterior and closest to your probe in this view. It can take up to 50 or 75% of the view. This would require more investigation into that pathologic finding. That's it for our examples of the parasternal long axis view pathology in cardiac POCUS. Thanks for joining us for the Neurocritical Care Society POCUS Bytes. Please follow us for more videos like this and visit neurocriticalcare.org to view previous and upcoming POCUS webinars. See you next time.